When it comes to the number of people who are in need of mental health or substance abuse services, Oklahoma's population ranks number 2 in the nation. In recent years, the State Department of Mental Health and Substance Abuse Services has made headway in addressing the need for programs that bring people back from the brink. Those efforts have shown when people have access to services instead of being sent to prison, the results are positive.
When you look at families in terms of drug court, 86% saw a decrease in unemployment, 82% saw an increase in income, 23% saw a decrease of folks who didn't have a high school education or a GED anymore, and 48% had their children living with them now.
Mental Health Commissioner Terry White says drug court alone has saved the state more than $20 million in 1 year by diverting women away from the prison system and their children from foster care, thus giving them help they need. It was one of the many arguments she laid before the House panel, which oversees the budget for public health issues.
Well, part of the reason for making these cases, as you might imagine where I'm headed, is when we have across-the-board cuts, which can't be avoided when the legislature is not in session, it ends up costing Oklahomans more when this agency is affected.
White made the argument the services her agency offers keep people from going into the prison system or getting emergency health care, which costs the state more than prevention or treatment. White was asked if those with substance abuse problems should receive help when the state is facing revenue shortfalls.
All of these people with these addictive problems voluntarily took that first step down that road. And so, there's some argument to be made that if we're going to cut things, we should spare the innocent victims at the expense of people who voluntarily chose a destructive lifestyle.
White countered with a statistic showing people dealing with addiction on average use alcohol or drugs for the first time before they're 16 years old, too young to comprehend the impact the decisions they are making. Many people who work with mental health and substance abuse services were on hand to show their support of the agency, which led to an emotional plea from Commissioner White.
All the folks who are here know that I actually do cry about these things because these are real people that we're looking at. And sometimes we miss that at the Capitol. And I know that you all struggle with a lot of tough decisions, but what I want to tell you is, if this committee doesn't stand up for this agency, nobody will.
From the state capitol, Jason Doyle, the Oklahoma News Report.